My name is Professor Muhammadou. I'm from the Gambia. I was the former Vice Chancellor of the University of the Gambia and currently the Vice President and Provost at the American University of Nigeria in Yola and the Chairman of Zenith Bank, the Gambia. The food security situation in the Gambia is of great concern because of the weak productivity of the agriculture sector in the Gambia. This is exacerbated by the fact that there is this Covid-19 situation in the country, which disrupted and affected the supply chain and value chain of the entire food infrastructure. The Gambia, because of its poor and weak agricultural productivity and sector, depends hugely on importation and generosity of donors to have adequacy for food security. This will be affected by the collapse of economies and the collapse of the distribution network and the value chain, and the Gambia's inability to import its basic necessity. The fact that our agriculture sector is not the most productive and is hugely affected by climate change and lack of mechanization and use of smart and emerging technologies, as well as smart irrigation, makes the food security quite risky. So undoubtedly, our food security is so temporal and will be affected by the consequences of the COVID-19. The aftermath of the COVID-19 will challenge our government and our policymakers to ensure readiness to avert any potential situation to shift the crisis from health security to food security. What the government is currently doing is very important and very significant, is to contain the crisis of the pandemic, to ensure that the cases do not rise, and to rebuild the health infrastructure. The government is also mobilizing resources widely to support strengthening of the health infrastructure and to support the population, especially those that are affected most by the COVID-19. The Gambia depends heavily on tourism, the informal sector, and the services sector, as well as agricultural produce. All of these are grossly affected, which will slow down the economy and economic activity. The government is also intervening to provide financial packages and food to those members of our communities that are affected and do not have the ability to provide the necessary food and services to their families. So there is an announced package by the government to support those affected most. The private sector also have stepped up to the occasion. The Chamber of Commerce of the Gambia was able to mobilize the private sector through a television telethon that resulted in raising funds to about $15 million, targeting to support and complement the government efforts. They were also able to partner with the United Nations Development Agency to support the prisons of the country, as well as the sanitarium, which is one of the health facilities for the cure of TBs. Other members of the private sector, such as the Bankers Association, today donated $3 million on behalf of all the banks of the Gambia, including Zenith Bank, which I serve as a chair of the Zenith Bank, the Gambia. They met with the Vice President of the country to hand over a check to the President through her office to support the 6 municipalities across the country, so that those funds can be used to support members of these communities that are affected by the COVID-19. Also, civil societies are also engaged in these interventions. These are some of the activities. Of course, the government have put in place a state of emergency for 45 days through the Parliament to be able to ensure that appropriate policy intervention to restrain activities that may contribute to the rise of the cases. The government is doing what it can given the limited resources that it has, and these are being complemented or supplemented by private actors in the business community. In the minds of the Gambians, they're worried about their health security as well as their food security. The population of the Gambia is also worried whether the funds that are committed by the government will reach them in a very timely manner and in a transparent manner. They're worried about the fact that our health infrastructure is very weak, and the discussion in the minds of people that the government and policymakers will draw lessons from the impact of the pandemic to refocus policy and investment to upgrade the healthcare infrastructure, including an overhaul and upgrade of the hospital infrastructure across the country, and strengthen and support the healthcare workers across the country. It is also important that their food security is in their minds, because food security in the Gambia was always an issue and was inadequate before COVID-19. And now with COVID-19, this is exacerbated. People are worried because the dependency of the food security in the Gambia is mainly through importation. Gambia imports most of its food requirements from abroad. With the collapse and disruptions of world economies and supply chains and global chains, to be able to import the basic food needs poses a huge risk and challenge for the security of the country. They are worried whether the government's preparedness and readiness to put in place mechanisms to ensure that they prepare for the food security of the country beyond COVID-19. They realize that one of the major consequences of COVID-19 may be food security crisis if the government doesn't step up its efforts towards that. They also have realized that the COVID-19 have exposed the weak system of government that is in place. It has exposed the weak healthcare infrastructure and capabilities of our country. And in their minds that these lessons will be learned by government to reprioritize and focus and channel investments to strengthen the health infrastructure and food security. Food insecurity is as lethal and as of a crisis as this health insecurity such as COVID-19. It's a food insecurity in the Gambia will be catastrophic. So it is very important that policymakers, as they work very hard to successfully manage the COVID-19 crisis, to in parallel immediately to work to ensure that the food security of the country is stepped up with the highest urgency and priority it deserves, because it is the next bubble of crisis waiting for not only the Gambia but for most of African countries. It is equally important that we do not allow ourselves as a government or as a peoples to operate on an emergency mode and only react with interventions when there is crisis. We can avert that by planning our readiness and coming up with smart policies immediately. Thank you very much.